nurses, most of them sister in charge of various departments in Agartala's GBP hospital, the chief referral hospital of Tripura agitated against the hospital authority for inadequate protective facilities, mainly masks, besides sanitizer and sterilized gloves for themselves as well as for other health workers, including doctors. The discontent of the nurses have been simmering over the past many days, but this manifested itself into an organized protest. While protesting in front of the medical superintendent Dr. Ranjit Das official's chamber, the nurses demanded medically advised double-layer mask, sufficient quantity of spirit, adequate number of surgical hand gloves in good supply. Speaking to media person on the sideline of the protest demonstration, two senior nurses said that they had made a requisitions of all the materials and items 5 days back, but nothing has been done to supply this to the nurses and health workers. They also pointed out that beds for the suspected patients in isolation wards had not been placed in compliance with the norms of social distancing. The senior nurses also claimed that with the admission of the first COVID-19 patients, the sweepers and computer record maintaining staff have stopped coming to the hospital. The deliberate derelictions of duty on the part of the sweepers had already made the hospital a veritable hell because other patients are also suffering terribly and the problem must be resolved in the interest of all, said the senior nurse. To bring to the situation under control, Additional Chief Secretary of Tripura, Sanjay Kumar Rakesh, rushed to the hospitals and met the protesting nurses.
पहले तो उस पेशेंट को मेडिसिन वार्ड में नहीं आना चाहिए था, वो एरर ऑफ जजमेंट था, क्योंकि वो फ्लू क्लिनिक से में रहना था, फ्लू क्लिनिक के बाद उनको आइसोलेशन में जाना था जब रिजल्ट पॉजिटिव हुआ, तो मेडिसिन में नहीं आना था। दूसरा ये है कि मेडिसिन में जो है वो दूसरा पर्पस है, अगर कोई क्लीनलीनेस का इशू है वो सुलभ के साथ बात है, वो क्लियर करे। कोविड के आने के बाद थोड़ा जो पैनिक फैला है उसके चक्कर में बहुत सारे लोग नहीं आ रहे हैं, एक दिन में ठीक हो जाएगा, हम लोग उससे बात करके उसको क्लीन करवा देंगे। तो क्लीनलीनेस का कोविड के इन्फेक्शन से लेना देना नहीं है, ये दोनों दो चीजें, बट सफाई चाहिए, सही है, और सफाई करवा दी जाए।
He assured to solve the problem at the earliest, and to which the nurses relented and rejoined their duties.
जो क्राइसिस है पीपीई जो है और N95 का पूरे देश में क्राइसिस है, हम लोगों ने रिक्विजिशन दे रखा है हिंदुस्तान लेटेक्स HLL को और बाकी एजेंसीज को भी, जैसे ही कंसाइनमेंट मिलता है हम अभी एयर कार्गो से उसको रेगुलरली ला करके रिप्लेनिश कर रहे हैं। जो रिप्लेनिशमेंट का रेट है उसके आधार पे हम कॉन्फिडेंटली ये कह सकते हैं कि जितनी हमें जरूरत है उससे ज्यादा आज की तारीख में स्टॉक है, लेकिन डर के चलते अगर हर आदमी फुल प्रोटेक्शन में जाना चाहेगा तो उतना स्टॉक तो नहीं है ना, तो इसलिए जो भी रिक्वायरमेंट है उसके हिसाब से स्टॉक है, उसके हिसाब से सबको जिसको जरूरत है उसको मिलेगा।
In addition to the protest, contractual staff of the GBP hospital also expressed that they are also feeling insecure. The medical superintendent of the GBP hospital, Dr. Ranjit Das, called the leaders of the agitating nurse and assured them of fulfilling their demands. He also requested them to continue their service and all the demands would be met within the shortest possible time.
She was taken from this, she arrived actually first in casualty, emergency department, and then she was admitted in female medical ward. And after that, some of our doctor advised her to go to the clinic observation ward, and there the test was done and she got positive. And after this she was shifted to the COVID treatment center in NTS2 building in the third floor. And now she is undergoing treatment and she is very much stable. Those who are come about the direct contact, they are put on quarantine. Around 6 of our doctors and 1 nursing staff, they are put in quarantine, and others are home quarantine.
Meanwhile, Chief Minister Biplab Kumar Deb, who is also the Health Minister, chaired a meeting with the ministers and officials in connection to coronavirus pandemic and alleged that there are huge stock of PPE and other necessary equipment in the state. In GPP hospital alone, there are 111 number of PPE available, besides 1,420 number of N95 masks, 8,024 number of triple layer masks and 1 lakh gloves. Tripura on 6th April reported its first novel coronavirus case after a 45-year-old woman from Udaipur tested positive at the Agartala Government Medical College and GBP Hospital. Last week, Tripura Chief Minister Biplab Kumar Deb visited Agartala Government Medical College and GBP Hospital to review the preparedness. During his visit, health staff, including medical officers, demonstrated a mock drill as to how they would provide treatment if anyone is tested positive with coronavirus. Bureau Report.